Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Charles here all the way here from Vancouver, British Columbia, and Charles is a self-confessed crack addict, and he's got his wife down here to get her adjustments, and she hates chiropractors. So, we're going to do something unique in this video. I'm actually going to do an entire case history and examination for you and video the entire process for you, with Charles's permission, of course.
Yep. Okay,
go ahead and have a seat right there for me, Charles. So, if you had a laundry list of all of your complaints, leaving Ann out of it, what would be your number one issue you're dealing with?
Lower back pain and mid back.
Is the low back pain worse on one side or the other, or does it go down to your buttocks or your leg on the other side?
More on the right side.
Okay. How far down your butt or leg does the pain go?
Right to the top of my butt.
Okay, so more just right in your SI
yeah.
joint? Okay. If you had to rate that pain on a 0 to 10 pain scale, as we're sitting here right now, where would you put it?
Right now?
Yes, sir.
1.
Okay, and what's the worst it's ever been?
Mama, what are you doing?
About 7.
Okay.
Mama.
So what's your number 2 complaint?
Mid back.
Okay.
Mama.
Yeah, between your shoulder blades?
Correct.
Okay. And if you had to rate that pain on a 0 to 10 scale, how would you rate that?
5.
Okay. Moderate. And what's the worst it's ever been?
Maybe about 6.
Here
Okay.
I go.
Does that pain ever radiate around in your ribs into
No.
your sternum or
No.
chest?
No.
Okay. Okay. It looks like you get some neck pain too.
Yes, when waking up from
Get a
after
crick in your
sleeping,
neck
yeah,
sometimes?
usually have a crick
Okay.
in my neck. Usually on the right side.
Okay. Does it go out to your right shoulder blade at all?
Yes.
Okay. Do you have pain in your neck today? Besides Ann?
Besides Ann, just a little crank. Just
1 or
a little
2?
bit. 2.
Okay. And the worst ever?
Worst ever, 7.
Okay.
For sure.
Now, when you get the lower back pain, have you ever lost bladder or bowel function?
No.
Okay, good. If you lose bladder or bowel, it's not funny. Bladder or bowel function, you need to get to a hospital within 12 hours and have surgery. You'll be wearing a colostomy bag or catheter the rest of your life. That's a serious neurological deficit. Yep. But since you don't have that, you don't need to worry about that.
Thank God.
Yeah. So, you get headaches ever?
Yes, occasionally.
Okay, what's occasional to you, frequency-wise?
Once every couple months.
Okay.
I think I
And where are your headaches located when you get them?
Usually right up
Front?
front.
Okay. Do you have a headache right now?
No.
And the worst headache you've ever had on a 0 to 10 scale? 10 means pain so bad you're in the hospital getting morphine IV.
No. An 8.
Okay. Pretty severe then.
Yeah.
You ever get dizzy or nauseous or pass out with those?
Nausea.
Nausea? Okay. Do you feel any of that right now?
What
No.
are you doing?
Do you see halos?
Yes.
You do. Well, I bet you see stars all the time. Does that get up to 8 as well?
The nausea?
Yeah, with your headaches.
Not really. Goes
Okay.
up to like a 6.
6, okay. You ever throw up? You're so nauseous?
No.
Okay, good. Have you ever had a heart attack or stroke or cancer or diabetes or high blood pressure or any other medical conditions that you're currently under the care of a physician for?
No.
Okay.
Who's this?
That's called a review of systems. He had no organ issues, liver, gallbladder, or gastrointestinal system, anything. Okay.
Look at this. Mama. It's gone.
Xavier, I'm gonna have to put you out front if you don't be quiet.
No.
Okay, so what else you got?
Sometimes some knee pain.
Okay, both sides?
Yes.
Is one worse than the other?
The left.
Okay.
No.
How would you rate your left knee pain today or right knee, either one?
Maybe a 1.
Okay, and the worst ever?
Worst ever, 4.
Okay. Have you injured your knees in a sports activity or car
Basketball.
wreck or anything? Basketball?
Yeah.
Okay, what else? Do you ever get shoulder pain, elbow pain, wrist pain, hand pain, numbness or tingling in your arms or hands or legs or feet?
No.
Ouch.
Do you ever have numbness or tingling in your head or your face?
No.
Okay. And you've never fainted or passed out?
No.
Okay, good. Don't get dizzy?
No.
Okay, good. Is there any other history in your past or now that we have not discussed that you think I should know about or be aware of?
I do not believe so. No.
Okay.
You know everything.
Okay. Well, I don't know everything, but now I know everything that you've told me. So, this is called the case history. This is where we're finding out about the patient's issues or symptoms, and then finding out, how long you've had those. How long have you had your problems with your back and your neck?
Ever since my car accident in 2010,
Okay. Rear-ended.
rear-ended. Yes.
Okay. And you received treatment for that, right? Chiropractic care?
Yes.
And how many times did you go?
Once a week for 3 months.
For 3 months.
Yes.
And you were treated and released?
Treated and released. Yes.
Okay. I'm looking at his health history here, and that's really all I see down there. Have you ever had any x-rays or diagnostic studies done on your spine or MRIs,
I
CT
did have an
scans?
MRI
When was that?
for the
For this
2010
accident?
this car
Did it
accident.
show any pathology or herniated disc or
A
anything?
herniated disc in my
Neck?
in
back?
my lower back.
Okay. You know what level? Was it L4, L5, L5, S1?
L4, L5.
Okay. But you haven't been any recent trauma since you've had this chiropractic care then, right?
No.
Okay. And those MRI?
Correct.
Okay.
Wow.
Alright, so let's examine you now. I'm going to start from the very beginning. I'm going to have you stand here and check your posture first. Okay, let's have you close your eyes and bend your head forward and backwards for me, please. And then back to neutral with your eyes closed. Now I'm analyzing his posture on the x-axis, the y-axis, and the z-axis. And as you can see from the side there, Ian, see how his head's way forward, see how his ears dropping all the way out here? You've got a loss of the normal cervical lordosis here. And your head's also translated to the right a bit. You're a side sleeper too?
Yes.
Okay. Okay, so I want you to bend over like you're going to touch the floor. Tell me if it hurts anywhere.
You're right.
Okay, backwards now. That hurting you a little back a little bit?
Little
Cold?
tightness.
Okay, go backwards. Does that cause pain anywhere?
No.
How about when you go to the left?
A little bit.
Okay. How about when you go to the right? And more than the thoracolumbar?
Nothing.
Nothing? How about when you twist left? Twist right? Does that cause any pain anywhere?
No.
Okay, good. Let's have you sit right here for me and face that way, please. Now, I've already watched him walk back here so he didn't have any foot drop, or he can stand on his toes and his heels. Tell me if this hurts anywhere when I push down.
No.
Okay, I'm going to go backwards now to the right and push down.
Nope.
Okay, go backwards and left and push down.
No.
A little crank on the neck.
Okay,
That's it.
that's a positive maximum foramina compression test on the left. And if it tilt your head this way, does this tighten up?
No.
How about when I do this?
No.
Okay, if you go this way, does this one tighten up or here?
No.
How about when I do this?
A little bit.
Okay, right there.
Here. Yeah.
Okay, if I lift straight up, does this feel better, same, or worse to your spine?
Same.
Okay, look straight ahead. I'm gonna push down, resist. Good. Same thing here, resist. Good.
Mama.
Okay, I'm gonna pull out, resist. Now I'm gonna push in, resist. Excellent. I'm gonna pull out, resist. Now I'm gonna push in, resist. Excellent. Okay, let's check your reflexes here. Just relax this. Okay, let me hold it. There you go. Oh, there's your problem too. Go ahead and look up in the air for a second. No, just look up. There you go.
You gotta be careful.
You're next, Xavier. You're next. Okay. So I'm gonna have you lay on your back for me, please.
Oh, my bad.
Other back. There you go. All right. So as I lift your legs straight up in the air, besides the tightness that you feel in your hamstring, tell me if this causes any low back pain or shooting leg pain.
No.
Besides the tightness.
No.
Okay. Does this cause any back pain or leg pain?
No.
Okay. Let's cross this here. I'm gonna push down here. Does this cause any hip or back pain?
Hip pain.
Hip, right there. That's a positive Fabry-Patrick test on the right. The straight leg raise test. Besides the tightness in your hamstring, does this cause lower back pain or shooting leg pain?
Shooting leg.
Shoots all the way down your leg?
Yep.
All the way to your calf?
Yep.
Tell me when it gets better.
Right there.
Right here?
Yep.
Does it feel better down here?
Yes, for sure.
Do you feel any of that same shooting pain when I do that?
No.
Okay, let's cross this one here. If I push this side down, does this hurt your hip or your back?
Hip.
Hip again. This is
Yep.
positive Fabry-Patrick in his left hip. He also had a positive straight leg raise test on the left at about 45 degrees. Push against my hand. Pull up. Turn in. Turn out. Push. Pull up. Turn in. Turn out. Good. Okay, I'm going to have you lift your head up. Tell me if this hurts anywhere in your spine now.
No.
Okay, good. Let's turn on your stomach for me now, please, sir.
Right here.
Okay. Now his left leg is shorter by 1/2 inch in the prone position here. When I bring his legs up, they get even. That probably tightens up a little bit in your low back and your thighs.
Yep.
See, he's got a left sacral deviation test right here, or left SI joint misalignment right there. Is that a little tender?
Yes.
More so than this side?
Yeah.
Yep. That's also where you get most of your back pain right here, huh?
Mm-hmm.
Yeah, these are all a little tender, aren't they?
Oh no.
All the way up into your lower thoracics there. I'm going to have you lock your right leg straight, lift your entire right leg off the table. Okay, relax that one. Do the same thing on the left now. Now, it looked to me like your left one was harder. Did it feel like that to you?
Yes.
Okay. So he has not only a left SI joint subluxation, but left sacral deviation down here as well, which will influence his lumbosacral spine biomechanics, and that's why he's got, these are all tenders. I'm touching them or palpating them. He's got paraspinal muscle hypertonicity in his lower thoracic spine, especially on the left, and he's got spinous process tenderness down at T7, 8, 9. Those are all tender, weren't they?
Yeah.
You get tight shoulders a lot too, don't you?
Yes. Very much so.
And your neck's out right there on the right, and right there on the right. And I bet some of your headaches start right there and go around too.
Mm-hmm.
Okay. So I'm going to push down, you resist. Good. Now I'm going to push up, resist. Good. Okay, I'm going to push down, resist. Now I'm going to push up, resist. Excellent. Good. Okay. So I've done a thorough orthopedic, neurological, and palpatory chiropractic examination on him. So I have determined that he has sacroiliac subluxation, sacral subluxation, lumbar subluxations, thoracic spine subluxations, costovertebral subluxations, and cervical thoracic subluxations, as well as cervical spine subluxations. So I'm going to do the same chiropractic Johnson adjustment technique that I do on everyone, which is why you came here, right?
Yes, sir.
See, some of these will be a little sore on you first too. not screaming as loud as Ian was. That's good. There. Yeah, see, that was really sore. Yep. Putting the curve back in your lumbar lordosis here with this one. That's it. Yes, sir. Mm-hmm. Okay. Yep. Okay, you're gonna feel your head popping up a little bit on this one, Charles. There you go. Perfect. Okay, let's turn you on your back now, please, sir.
Oh, wow.
Yep. A little different in person, isn't it?
Yeah. Much different in person.
Okay. So I'm gonna bring your head up and over your shoulders. This will help reduce the straightening of your cervical lordosis and restore the cervical lordosis. Good. Okay, slide down about an inch. Okay. Mm-hmm. Both shoulders, clavicles. Slide up this way just a bit for me, please, Charles. There we go. Yep. Okay, you can relax your hands right here. Yeah. Just relax your leg in my hand here. There you go.
Oh,
now you
wow.
should have felt that from your knee all the way up to your low back.
Wow.
Did
Yes.
you?
Yes, very much so.
Okay, let this one go.
Oh.
Same thing there?
Yep.
Good deal. Okay, let's go ahead and sit up and face towards Dan.
Wow.
Yeah. We're just getting started. Dan's ready for your ring dinger. Boy, that was crack Guy's gonna love you. Did you hear that right shoulder?
Oh,
There we go. I probably thought there was a car accident out on the beltway.
That was beautiful.
Yep. There we go. There we go. Good. Okay, let's come over here on this table now. Okay, butt right here, head up this way. I've been to Vancouver before. I love Vancouver.
It's a nice city.
It is a nice city. It's a big city, isn't it?
Yep.
Slide down underneath there. What's the population up there now?
I couldn't even tell you.
Probably about 3 or 4 million, 5 million.
Probably. Around that.
It's almost the size of Houston, isn't it?
No, not even close.
It's not even close to being Houston. You guys got chiropractors up there, right?
Yes.
Yeah, just think about that for a second.
Yeah. The thing is, I don't use them very much. I'm an American, so.
Oh, okay. All right. So just breathe through your nose. Keep your teeth together and relax. Yes,
Oh,
sir.
my goodness.
Yep. Should have felt that all the way down, Charles, to your low back.
Yep. That was beautiful.
Okay, let me have your head here. Yes, sir. Oh, yeah. Doesn't get any better than that. Yes, sir. You said you had some pain in your feet sometimes?
Sometimes, yes.
Go ahead and take your shoes off for me.
Okay.
Here, I'll get them. There we go. Yep. He's noisy all over, huh? No wonder he's a crack addict. There you go. Yes, sir. There you go. Good. Okay, let's stand you up over here in front of the mirror now, Charles. Wow. Yep. Okay, I'm going to have you close your eyes and bend your head forward and backwards for me, please, sir. Back to neutral. Okay, so take a look in the mirror now. Your head's up straighter, you're standing up taller, your shoulders are squared off more.
Yes, sir.
But you still need to do this. Lift your shoulders straight up and back. Simultaneously flare these guys here. Now your head's a little forward and right, so we bring it straight back first, translate left, and then look backwards. You're gonna feel a little tap on your atlas right here. Another one right there. Now relax. Now try that again. Tell me what difference you feel in this one versus the last two.
Wow, that's
Did it feel
real
smoother?
smooth. Very smooth.
Good. So do you feel better than when you walked in the door?
Absolutely. Absolutely.
So this is you guys' very first experience here at Advanced Chiropractic Relief, and you got an appointment by going on our website, right?
Yes, sir.
Did Renee get back to you in a timely manner?
Almost the very next day.
Very next day. And we try to get back to people within 48 hours. She did that, right?
Yes.
Good.
She did.
Good. So what would you tell our YouTube fans around the world about your very first experience here at Advanced Chiropractic Relief?
It was a great experience. I think everybody should come out here and definitely take advantage of Dr. Johnson while he's here.
Specifically for the ring dinger, huh?
For sure.
All right. Thank you very much for sharing your entire experience with everyone.
Thank you very much, sir.
And we did have his written permission to do so. So we're not violating any HIPAA regulations for those of you who watch out for that stuff. They are from Vancouver, British Columbia, which is up in northwest Canada, right?
Yes, sir.
So I'm just going to put them on an as-needed basis. So when you guys want to come back for an adjustment, you're already patients here. All you got to do is text Renee and she'll get you in.
Perfect. Thank you.
Very good. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.